Zachary Smith, May 9th, 2020. Different areas we need to cover in the presentation. So here to talk about the skeletal system today. So very important system, a few important different functions. Acts as the kind of rigid structure that makes up the human body. It provides a point of attachment for muscles and ligaments to attach to assist in locomotion. It's important in protection of important vital organs. Also important in the creation of red and white blood cells. So very important system. Can be broken down into two parts. We have the axial skeleton, which is comprised of the skull, vertebral column, and the rib cage. And then we have the appendicular skeleton, which is what I predominantly deal with at my job in orthopedics. That's comprised of the different limbs, so from your arms down to your fingers, and then your pelvis to your toes. That's all the appendicular skeleton. There's different classifications of bones based on their shape. So we have long bones. An example of this would be the femur. We have irregular bones. An example of that would be the any of the bones in the spinal column. We have sutured bones, so bones that are fused together along a suture line. Those would be the bones of the skull, would be an example. We have short bones, so different carpal bones, different tarsal bones, those are all short bones. And then we have flat bones. So flat bones would be, rib cage, kind of long, really flat bones. And then we finally have sesamoid bones. So sesamoids are free-floating bones that don't directly articulate with any other bone to form a joint. We've got some sesamoids under your first toe, and then the largest sesamoid bone in the body is your patella. So then we're going to move on to the names of the different bones. So starting up top in the skull, we have the frontal bone, laterally and superiorly the parietal bone, posteriorly the occipital bone, and then inferior but still lateral as the temporal bone, so where temple is. Front of the skull, we have the bottom jaw, it's called the mandible, and then the upper jaw is the maxilla. The cheekbone, it's called the zygoma or zygomatic arch. Right in between the nasal cavity, we have the vomer. And then kind of the bridge of the nose, bilateral, we have two nasal bones. And then where your tear ducts come out of, a little hard to see, but you have your lacrimal bones. And then kind of deep to the eye socket, we have the sphenoid and ethmoid are kind of back there, a little hard to appreciate. More bones to the skull that you can't really appreciate on this skull, but those are all the superficial skeletal bones. Moving down, we have the vertebral column. Can be broken down into three different parts: cervical spine, thoracic spine, lumbar spine. Cervical spine is the first 7 bones. The thoracic vertebra is the next 12 bones, and then the lumbar spine is the bottom 5 bones, and then those turn into the sacrum and the coccyx that are kind of different bones that are all fused together. Moving back up, we have the rib cage. We have 2 ribs, more superiorly, and then what are known as kind of false ribs because they don't directly articulate with the sternum. The sternum is comprised of a manubrium body and xiphoid process. And then the clavicle articulates with both the sternum at the sternoclavicular joint, and then with the scapula, which is kind of your shoulder blade at the acromion process. Your humerus then articulates with the scaphoid, or with the scapula, and that's the shoulder joint. So we have the humerus, and then more distally, the forearm has two bones. So laterally, we have the radius, medially, we have the ulna. And then we have all the carpal bones that are really small. So we have the kind of hard to distinguish which different ones are, but we have the trapezium, trapezoid, the hamate, triquetral the capitate, lunate, and scaphoid. And then we have the more distally than the carpals, we have the metacarpals. So labeled from the thumb to the small finger, first, second, third, fourth, and fifth metacarpals. And then we have the phalanges. The thumb has a proximal and distal phalanx, and then the second through the fifth fingers have proximal, middle, and distal phalanxes. We have here the pelvis. It's kind of the pelvic girdle, is the which is comprised of different bones that are fused together. And then we have the femur. The femur articulates with the pelvis at the acetabulum to form the hip joint. Patella right in the front, your kneecap. And then the lower leg is comprised of the tibia and the fibula, the tibia being the main weight-bearing bone of the lower body. Then directly inferiorly to the tibia, we have the talus, and that's the main weight-bearing bone of the foot. Right below the talus, we have the calcaneus, and that's your heel bone. Then the other carpal bones, moving from medial to lateral, so medial and more proximal, we have the navicular. And then just distal to the navicular, we have the medial, middle, and lateral cuneiforms. And then most lateral for the carpal or tarsal bones, rather, we have the cuboid. And then similar to the phalanxes of the fingers, for your toes, we have metatarsals, and those similarly labeled first, second, third, fourth, and fifth, moving from medial to lateral for the phalanxes of the tarsal for the foot. And then we have proximal and distal phalanx for the first toe, and then proximal, middle, and distal phalanxes for the second through the fifth toes. As far as significance for what my professional aspirations are, I currently work as an orthopedic tech, so my main functions is my job is to work in conjunctions with the doctors, physicians, assistants, to look at x-rays of patients that have fractures and then determine the best type of cast, brace, splint to put them in, or whether the injury may need a surgery if it's not going to heal well with a cast. And then my ultimate goal being a physician's assistant in orthopedics, so I'm really interested in total joint replacement. So when articular cartilage wears out, you can get actually no cushion between the joints, so that would warrant a joint replacement. So really, really important body system, something that I'm passionate about and find very interesting, and hopefully learned a little bit as well. Thank you.